Welcome. Today, we're diving into the Biopharmaceutics Classification System, or BCS, and how it plays a crucial role in injectable drug preparations. We'll explore the science behind it, why it matters, and what it means for developing effective medicines. Let's get started. Let's start by looking at what the Biopharmaceutics Classification System, or BCS, really is. It's a scientific framework that sorts drug substances based on two key factors: how soluble they are, and how well they pass through the intestinal lining. Developed back in 1995 by Midden and colleagues, it's now widely adopted by major regulatory bodies like the FDA, EMA, WHO, and ICH. The BCS helps predict how a drug will be absorbed when taken orally, supports bioavailability assessments, and even allows for biowaivers in certain cases. This makes it a powerful tool for guiding formulation development, reducing unnecessary studies, and smoothing regulatory pathways. Let's start with the fundamental principles behind BCS, the Biopharmaceutics Classification System. At its core, it's about two key properties: solubility and permeability. Solubility is simply how well a drug dissolves in water-based fluids. If a drug dissolves easily, it's considered highly soluble when the highest dose can dissolve in 250 milliliters or less across a range of pH levels. Permeability, on the other hand, measures how much of the drug actually passes through biological membranes and gets absorbed. High permeability means at least 85 to 90% of the drug is absorbed in humans. Why does this matter? Because the rate at which a drug dissolves directly affects how much of it gets absorbed, its bioavailability, and ultimately, how effective it is therapeutically. When we talk about formulation challenges, the Biopharmaceutics Classification System, or BCS, breaks them down into four main classes. Class 1 has minimal issues; both solubility and permeability are high. Class 2 struggles with dissolution, meaning the drug doesn't dissolve easily, but permeability is good. Class 3 flips that: solubility is high, but permeability is limited. And Class 4 faces the toughest hurdles, with poor solubility and permeability. Understanding these classes guides us in choosing the right formulation strategies. Let's talk about the main regulatory uses of the Biopharmaceutics Classification System, or BCS. It helps with biowaivers, which can reduce the need for bioequivalence studies and support generic drug approvals. It's mainly applied to immediate-release oral solid dosage forms. For injectables, BCS isn't about absorption but still guides API selection, solubility, stability, and preformulation. Major regulatory agencies like the FDA, EMA, WHO, CDSCO, and PMDA all recognize its importance in drug development and approval. When we talk about formulation development, the Biopharmaceutics Classification System, or BCS, plays a key role. It guides our choice of excipients, whether we use co-solvents, and how we approach particle size reduction. Sometimes, it even points us toward advanced options like liposomal or nanoformulations. Now, you might wonder, why does BCS matter for injectables? Even though these skip the gut, BCS still helps us assess solubility, which affects injection concentration, the need for solubilizers, and the risk of precipitation. Plus, permeability is crucial for depot injections, intramuscular absorption, and tissue penetration. Let's look at some real-world examples of drugs that face solubility challenges when made into injectables. Paclitaxel and amphotericin B both fall into Class 4, meaning they have very poor solubility, causing issues like aggregation or low drug loading. Diazepam, a Class 2 drug, risks precipitation. These problems can lead to instability, pain at the injection site, and unwanted particles forming. To tackle this, we use techniques like adjusting pH, adding co-solvents or surfactants, and exploring advanced options like nanoparticles and lipid-based systems. Let's walk through an example calculation for solubility determination. We start with the highest injectable dose, which is 100 milligrams, and the drug's solubility at 20 milligrams per milliliter. Using the formula, required volume equals dose divided by solubility, we find that the volume needed is 5 milliliters. This volume is practical for injection, meaning the formulation is suitable. From a regulatory standpoint, this ensures the dose can be administered safely and effectively. Let's walk through an example calculation of the partition coefficient, which helps us assess a drug's permeability. We start with the drug concentrations, 50 milligrams per liter in octanol and 5 milligrams per liter in water. The partition coefficient, or P, is simply the ratio of these two concentrations, 50 divided by 5, which equals 10. Taking the logarithm of that, we get a log P of 1. This tells us the drug has moderate lipophilicity, suggesting it can pass through membranes fairly well. When we're dealing with BCS class II and IV drugs, designing injectable dosage forms gets tricky. These drugs often need special formulation approaches to work effectively. Common strategies include nanosuspensions, liposomes, micellar systems, emulsions, long-acting depot systems, and lyophilized formulations. The goals here are clear: improve solubility, boost stability, control how the drug releases, and reduce irritation at the injection site. A great example is liposomal amphotericin B, which cuts toxicity and makes the drug more soluble. When developing sterile formulations, there are several important guidelines we need to follow. These include USP standards for particulate matter and sterility testing, as well as ICH guidelines on pharmaceutical development and quality risk management. The FDA also provides specific guidance for sterile injectables. Key regulatory expectations cover sterility, particulate control, solubility stability, compatibility, container closure integrity, and stability studies. Meeting these requirements is essential to ensure product safety and effectiveness. When we talk about quality control and stability, there are several key studies we rely on. Accelerated stability tests help us predict how a product will hold up over time. Freeze-thaw cycles check if repeated temperature changes cause damage. Photostability looks at how light affects the product, while compatibility studies ensure all ingredients work well together. For injectables, parameters like pH, osmolality, and viscosity are critical. They affect safety and effectiveness. We also watch for risks like precipitation, crystal growth, and chemical breakdown. Finally, drugs with poor solubility demand extra attention, since their stability can be more challenging to maintain. When developing injectables, there are several key factors we need to keep in mind. Excipient compatibility is crucial. Everything in the formulation has to work together without causing issues. Sterility assurance is non-negotiable, since patient safety depends on it. Stability optimization keeps the drug effective over time. We often face challenges like drug precipitation or injection pain. Each problem has a root cause, like poor solubility or extreme pH, and a targeted solution, such as using co-solvents or adjusting the formulation. This slide outlines common hurdles and how we troubleshoot them. Let's look at a real-world example with paclitaxel injection. Paclitaxel is a tough drug to work with. It has poor solubility and low permeability, making direct aqueous formulations impossible. To tackle this, a co-solvent system using Kremofer EL and ethanol was developed. This approach created a successful injectable solution and improved delivery. However, it came with a downside: hypersensitivity reactions caused by the excipients. That challenge led to an advanced solution: nanoparticle albumin-bound paclitaxel formulations, which helped overcome those limitations. To wrap up, the Biopharmaceutics Classification System, or BCS, offers more than just guidance for oral drugs. It's a powerful framework that helps us understand drug properties deeply, shape smarter formulation strategies, and navigate regulatory pathways with confidence. When it comes to injectable preparations, BCS plays a crucial role, from assessing solubility and choosing the right excipients, to optimizing stability and designing advanced delivery systems. These principles, supported by key guidelines and scientific literature, truly elevate how we develop complex injectable medicines. That brings us to the end of our presentation. If you need any further support or have questions, please don't hesitate to reach out. Thank you for your time and attention. It's been a pleasure sharing this with you.